I'm here with my colleagues, Allison, Clark, and Adrian. Today, we kind of want to talk about, some of the frustrations that a lot of clinics face during a busy time of the year, which could be flu season. And we want to kind of talk about how we can handle those frustrations with automation. So if we just can go to the next deck. A little bit about my background. I used to be a clinic manager. I used to recruit doctors for clinics. And I've also did have a clinic on my own just prior to the pandemic. And I would have to say, my top frustrations of being a clinic manager, would have been those, incoming phone calls, faxing lab recs, referrals, making sure that they, successfully went through, my MOAs, inputting data, it could get super frustrating. And then, the amount of no-show appointments we had that could frustrate the doctors that were waiting around to see those patients. And then just like other little tedious admin tasks, which could lead into, patients being frustrated, angry, impatient. No patient wants to be on hold for 5, 10, 15 minutes. No patient wants to, stand in a long lineup to be registered. And what I think is that there's a lot of tools that you could incorporate into a clinic to kind of overcome those challenges. I remember during the pandemic, we had a flu clinic going on at the time, and we had about 8 doctors working from 9 a.m. to 6 p.m. And we usually had about 2 rotating MOAs, so 4 in total. And I remember that 2 of the MOAs actually called in sick. So it was pretty much, all hands on deck. And, we had lineups from, both entrances, outside, going into, the mall. And just the phone calls coming in nonstop, and, doctors, waiting to be, taken care of by, performing, urine tests, pregnancy tests. And it was just super chaotic. And I kind of thought to myself, like, what would have helped us back then? And what it boiled down to was, automation software for the clinics. If we can just head over to the next slide. I kind of wanted to ask you guys individually, what were your guys' top frustrations? Any challenges that you guys were facing at your clinic, during a super busy time? The chat function is open, so you guys are more than welcome to answer away. And I'm just going to mute myself.
Does anyone identify with any of these things? The green dots, and sorry for my voice, I have a cold. The green dots are representing when we did a survey, the most common challenges that clinics are facing. It's okay, it's a pretty cozy group. I think that in terms of who's joined, so we could probably keep moving.
Okay, no problem. We're just going to take it off from here. So I'm Ashley. I'm going to be hosting this webinar today. Just a tiny bit about my background that you guys already know of. I used to be an operations manager for startup clinics. I followed that by recruiting physicians, and then I was a former clinic and operations manager. So what we can do is I'm just going to take it, let Adrian take over from here. Adrian, if you want to introduce yourself.
Hi, everyone. My name is Adrian Sterzinski. Right now, I'm a healthcare technology consultant. So I do a lot of IT work, especially for medical clinics in Canada and the US, and as well as telecommunications. I'm also a part-time clinic manager for a clinic that's using Oscar EMR. And I'm familiar with all the EMRs that everyone uses and digital tools because I consult on those tools as well.
Awesome. Thanks, Adrian. I'm just opened up the chat function. I had a couple of people that joined in a little bit after. I noticed that Santana kind of mentioned that, from phone calls to faxing forms and reschedulings are pretty tedious. Really agree with that. And I have Rosemary labeling and naming documents and labs. Yeah, that could be crucial because we used to get back a lot of pap tests that were mislabeled, urine tests, any specimen that were mislabeled. We used to get a lot of that back. And we have to perform all those all over again. And again, that was super, super tedious. Anyone else before I hop on to the next part of the webinar? Okay, we're just going to continue. If you want to go to the next one, and I'm going to have Adrian share his screen. He's just going to talk about a couple of tricks and tips on how to make the most out of your Oscar EMR and some functions that a lot of doctors and MOAs don't really use, but could use to make their clinic run more efficiently. So I'm going to let Adrian share his screen from here.
Hi, everyone. So I'm going to start off by asking the question, who here would like to spend less time in front of the screen and more time spent valuably with patients instead of useless data entry and phone calls? Well, we've heard that many people would like to start helping the doctors get through the day in a more efficient way. The impact of the tips I will show you here today is to help you get around your EMR program faster and to have a bigger impact with your time at work, have less stress at work, and maybe get home faster. These two quick tips that I will share with you today are for Oscar-based EMRs. Before sharing my screen, just to describe the first tip, everyone in the medical office has tasks to do every day, which everyone is familiar with. And more often than not, they're not being managed efficiently, leading to increased time spent and frustration. In fact, most of the clinics I consult for, the staff and doctors are using messages, sticky notes, texts, Notepad, or other apps to keep track of different tasks they need to do. I've helped many clinics make use of their clinic technology and digital tools more efficiently, and it only takes one simple fix to your workflow, which will save hours per day. So I'm going to be sharing my Oscar screen. There we go. So when the doctor or MOA needs to assign a task to someone in the clinic, or just to keep a track of a task for themselves, you should be using ticklers to do this task management. To create a tickler, you can just click on the Add Tickler button within the patient chart, master record, or just from the handy little tickler link up here. Most people I work with have no clue what is tickler because the name is kind of weird for this. It's not self-explanatory, so you have to kind of figure out what it is. So when you click tickler on the schedule, just click Add Tickler, and now you've started the way of unlocking much more efficient task management. So what is in it for you? Well, for ticklers, this leads to more efficient time spent because your tasks will be categorized. And I'm going to show you how exactly doctors use this on a day-to-day basis. So let's type in a test patient to link this task to, okay? And I'm going to link it to myself, this demo account, and this icon to add this new task is accessible from almost anywhere in your system in the EMR. So for example, let's just create a little task to recall in 6 months. So you can make this recall X results or whatever you need to. A lot of times the doctor will write a task to call up a patient for some cancer screening in 6 months, etc. And well, here you go. There's even a quick, handy date picker right here for all these different times that are super frequently used in offices. And I'm just going to submit this task to myself. And what will happen is in 6 months, I'm going to be notified that there's a new task for me to complete. Well, what if you want to change that? What if you want this task to be today? Well, that's easy. You can just create a new task and keep the date as today. And I'm going to make myself a message, something that's really common and just a lot of reasons you can have, but most common I see doctors telling the MOA to call the patient to come in as well for blood work review or something like that, or high blood pressure. There we go. This is probably what Tickler users are very familiar with. This is your efficient task management screen. Now understand that depending on your system, the screen may look a bit different and may look a bit more fancy or a bit less sophisticated, but here we have this task management screen. And this is accessible just by clicking, once again, the word tickler up here. Here's my task. I can edit this task, do whatever I need to. Now, I'm going to demonstrate to you a way of creating tasks linked to documents and lab reports that you will be very surprised to learn. So we're going to go into this patient here. I'm going to go into their chart, pretend I'm the doctor right now. I'm going to open up a document. So let's say this is like an X-ray result or something like that, that the doctor is viewing in their inbox. I just have to zoom out from the screen. And here on the right, this will be probably a bit different for your system. There's going to be a button that says tickler or it says task. Just click that. Now, just like assigning a task in another way, you're going to type in your message. So let's say I'm going to have the MOA recall this patient right now. And I'm not going to use the date picker because I want the task to notify them right now. You can just select their name. I'm going to select myself, for example, and click submit. I'm going to go in the chart. You can see there's a task link to them. There's a whole bunch of tasks, but I'm going to go and pretend I'm the MOA, and I get notified just by clicking on tickler. That's all you have to remember. Just click on tickler to manage this and to start looking for these tasks. And I see this new task here that was just created, and it says attachment. There's a little link for an attachment. When we click attachment, I see the attachment the doctor just referenced. So instead of the doctor having to write a message or a text message or a sticky note or whatever it may be, referencing a specific lab result or a document, let's say an X-ray report or whatever it is, they can just create a tickler from this lab result or document, and right away the MOA will have the message. So let's say book the patient for follow-up, or they will have the attachment right in front of them. So here, this is our demo attachment. I'm going to review it. Okay, it says X-ray result. Pretend I'm going to have to call the patient to book this follow-up appointment. Now, if you have Cortico, the platform, you can have this automated really easily for you so that you can press a button from the patient's profile and it will send them a kind of recall email instructing them to book a follow-up. So this eliminates the need for you to do this manual process of booking them. However, for those that need to book the patient manually, which is inevitable to find what is the next available appointment without going through the doctor's schedule day by day, because most commonly, before discovering this magic button that I will show you, the MOA is going day by day through the schedule and looking for an opening, sometimes double booking by mistake or going too far ahead when there's something closer. I'm sure you're all familiar with this at some point. And the most efficient way to just look up what is the next available time slot is to go to your familiar schedule screen, which is mine right here. A lot of clinics have multiple doctors, so you can have 100 different schedules right on here. Each one of these schedules, let's say just this one, for example, it has an S button. Well, S is kind of non-descriptive, so you hover over it and it will say search. Well, you think to yourself, search what? So just click on this S, and now this means search for the available appointments. Well, this is a very easy screen because it just asks you to search for appointments, what time you want to search for. So I'm just going to keep it the default. So I'm going to search for any weekday appointments between this time. I'm just going to click search. Oh, look, there's appointments available. Do I have to go through the schedule and just book them manually? No, I can just click on this time. Okay, this saves me a lot of time. Now I can just type in the patient, book them as usual. And we're done. Well, this is not always the end of booking appointments because some clinics require you to call the patient to minimize no-shows in advance or do other things, categorize the appointment, etc. Well, with Cortico, our platform, we can just select the appointment type. Let's say it's an in-person appointment, and then that's all we have to do. It's not a mandatory step, but the patient will now, once we add the appointment, they're going to get an automatic reminder and text message and everything that they have an appointment upcoming. We've saved a lot of time, at least 6 minutes in this process with these 3 shortcuts. The doctors saved themselves probably 10 minutes just by using the tickler to create this task for the MOA, because they just create this tickler that has the attachment. So the MOA will not be asking them, what do you mean, which result? Because sometimes when you call the patient and tell them you need to come in for follow-up, they will question you, like, what is it about? So it's good to just have it prepared what you're calling them about. And then we book them the next available appointment really easily through that appointment lookup button, which once again, if you missed it, it's right here. And if you have Cortico platform, we minimize the no-show because the patient will get the reminder. So this is a much more efficient workflow process. Just going to go over it briefly once again. All you have to do to start making your tasks more efficient is to use ticklers. And this tickler option is right here. But you can also just access it from the patient chart. So let's go to the patient. Their master record, they have an add tickler button. And let's go just to their chart. And they also have an add tickler button right here. And I see that the ticklers are not marked as complete. So I'm just going to go in. Since I completed this task, I'm going to mark it as done. Okay, this is done as well. And as a last note, you can also look at ticklers from other people. So if you have other MOAs, you want to check their tasks. A lot of times, if someone's sick, maybe you want to do some of their tasks. You can just check their tasks, filter by everything you need to, filter by dates. You want to see a future task, you just filter by the future date. It's very easy. That's all. Thank you. I'm going to stop sharing the screen and we're going to continue with my next point.
And Adrian, since you're at a stopping point, I did see that Rosemary had her hand up earlier. So Rosemary, do you still have a question that you wanted to ask? Okay, well, I guess we'll just continue then.
Okay, we'll go to the next deck, Allison. Okay, go ahead, Adrian.
Okay, now I see this. So as you see on screen, we're going to be talking a little bit about phone call optimization. Now, what is the most common pain point at the office? Well, most people will always say it's the phone call burden because people are calling nonstop. It takes your time away from other relevant tasks that can be more productive, and it's just repetitive. So what is a phone system? That's the first question. Just simply put, it's a system that, let's say when you call a larger company and it says to press 1 for sales or 2 for support, well, that's basically what a phone system is. It answers the call automatically. It makes the call experience more efficient for the company and for the patient. So what is in it for you? Well, when you have an optimized system, very simply put, you're going to have a lot less calls, and the calls that are coming in are going to be much more relevant. And the patients that are actually calling you, they're the ones that actually need to speak with you. So here's what we're going to do. I will show you how you can automate inbound phone volume, that part of your clinic, in a few minutes, and eliminate up to 40% of calls right from the bat. When patients call your office number, they need to have a pre-recorded message that they hear that clearly tells them to go to your website for online booking and cancellations, and preferably if they need to contact staff, then the best way to do so is by emailing. Why you need this? Well, email is a much more controllable way of communicating with patients. You can set up automatic responses, which will answer their questions for the most part right away, eliminating the need for them to take up the MOA time. And email can be shared easily between multiple MOAs. So what we suggest is that you set up an email account, which is shared by all of your MOAs, clinic staff, and have your phone system message. And we're going to give you an example of a message in a minute. Have your phone message direct patients to book online with a system like Cortico, whatever you have, so that you don't have them calling you nonstop for booking, because that is repetitive, and have them email you if there's something that cannot be done with online booking. So that leaves the other option for those that cannot go online, which are very few these times, but also pharmacists or specialists or other people that need to speak with your clinic. That gives them a much less wait time on the phone. They're not going to be waiting so long. And you're going to have much less phone volume to deal with, since all the calls coming in are those that need to be coming in. So drastically less phone volume means much more time can be spent on other tasks. This type of automated answering is really easy to set up on all modern phone systems. And across the country, many clinics I worked with were stuck on these 20, 30-year-old systems that at the beginning of COVID, I switched them to these modern cost-effective systems that MOAs would save a lot of time on. And patients will be booking online much more frequently, because that's the norm right now these times, which led to elimination of over 40% of incoming calls right off the bat, because people were listening to how the clinic would like them to handle all these calls, their requests. To get started with an efficient medical clinic phone system, the easiest way is just to reach out to myself directly by email at adi@aditech.ca. We're going to put it in the chat, but it's just adi@aditech.ca. So speaking of how you can optimize your calls, we're just going to be showing you right now some example phone greeting scripts. If we can go to the next slide. Oh, here we go. So the default greeting you should have, it needs to be simple and as short as possible. So I suggest you write a script for your message that you're going to record and listen to it twice. Fix anything that you want to adjust, anything that's not clear. And yeah, you'll be surprised how many times something seems clear, but in writing, when you read it, but when you listen to yourself, it's not that clear. So just pretend you're the person listening on the other end. We're going to want to keep it short to eliminate any kind of people losing attention. And a good example greeting for clinic is, thank you for calling such and such medical clinic. For appointments, please book online at our website, which is medicalclinic.ca. As well, if you need to book, cancel, or confirm the date and time of any of your appointments, please visit our website. And then after you said that, you can say your email details. So for fastest response, please email us at such and such email, and that will be the most efficient way to get your question answered if you cannot book online. And then those people who do not have access to online, or if they're calling about something else, let's say specialist, pharmacy, elderly person, then they're going to have a much faster time getting a hold of the staff on the phone, because the next message after this default greeting, it will say, for appointments, please book online. Otherwise, if you need to speak with staff, remain on the line, something along those lines. We have an example on screen right now. It's kind of long. I will not read it exactly because it's just like what I said. However, if your clinic is closed, after it plays your default message, you should just have it say, what are your hours? And whatever you need to say, such as your after hours clinic number. And with these modern phone systems that everyone should have in their clinic to optimize their calls, you can have it set so that the patient does not leave a voicemail after hours, if you would like that, because a lot of times they expect someone to return their call right away if they leave a voicemail, which takes up a lot of time for staff. So you can have it just play the message and then say, thank you for calling, goodbye, and it hangs up. Just like when you call a bigger company outside hours, most of the time, it will just play the message. And then you call and they have actually people there to help you, which makes the call process much more efficient and saves you time.
Awesome. Thank you, Adrian.
Great.
Allison,
So
sorry, go ahead, Adrian.
That was all. Now we were going to start speaking about the clinic website.
I might have been, or I might have been scheduled to do that, but my voice is pretty awful. So Adrian, if you want to, or Ashley, when you guys want to go over it, that's great as well. Or I can try it if you prefer.
All right, well, I'll start off just speaking a bit about this. So good clinic website is essential for any clinic. If you want to make your clinic much more efficient and reduce calls, well, over 90% of clinics right now that have efficient phone volume, etc., they're all using an online booking system. They're all using an efficient phone system. They're all using their EMR most effectively, which is what we're here to help with. And they have a great website. The reason why you need a good website is because that eliminates a lot of contact from people to your staff. So most questions, like frequently asked questions, what does your clinic offer? Can you do this? Can you do that? What are your hours? How can I get there? All of that can be just put on the website and people will not call that much about it. And if they email you, the automatic response should point them to your website so that they see all their questions answered and they don't waste your time that much, right? So here we have an example on screen of a great website. So this clinic obviously has an online booking system, which is essential at these times. People are expecting to be able to reserve appointments during their free time because not always do they have a time to call the clinic, right? So they have a big button with clear text to guide patients to the online booking flow. You can customize your website however you like, but you should always have a big button for booking online. As well, there is a button for modifying appointments and canceling. So if your booking system like Cortico supports this, well then great, you can just put that on your website and people will be able to modify, look up, or cancel their appointments, eliminating that need for them to call. Right, and there's of course the prominent call to action on all your website pages, which is just a book online. If you have a good clinic website, you also have to make sure that it's optimized for mobile screens, because a lot of times, unfortunately, the clinic sets their website and they 10 years ago and they never touch it again. Well, that's kind of a problem because right now, most visits to websites for clinics are done through tablets or smartphones, which have a smaller screen. And you want people on those devices to be able to book with you and do their business online easily without having to zoom in that much or having part of the screen not visible. So this is all easy to configure. If you need assistance, you can contact us. We'll be happy to make your clinic more efficient this way.
Awesome. Thanks, Adrian. If you just want to follow on to the next slide. So I think that those key elements, like having a strong website, having a strong phone system, those are strong, things to have in your practice. And also by saying that, automation for your practice is super important as well. Now that we're, getting over the pandemic, patients are coming in clinic to, see their practitioners. But there are some, tedious tasks that can still, maybe frustrate patients. It could frustrate MOAs, having to do the repetitive tasks, all the time. So it's super important to have, a system like, Verybooks, Oceans, Virtual Clinic, Cortico, to drive traffic to patients to that online portal. So, they have that option to book themselves, which will, reduce your phone lines. Have patients come in and self-check-in, using kiosks, and, just simple, tools that you can incorporate into your EMR, having, practitioners making sure that, each task is completed, even by, sending a, an intake form or maybe a requisition or referral, through the encounters of the patient's chart. So there's, those key elements that could, reduce the phone line. So your MOAs can actually focus on, more crucial tasks like, assisting the doctors, assisting patients that are in clinic, making sure they're all in the correct rooms and whatnot. And, human error can always happen, but, using automation can prevent, any of those, mistakes that can happen that can turn into possible bigger mistakes, like, for example, an incorrect, prescription being given to someone that might be allergic to that medication. So, reducing, admin tasks with automation and having them focus on, crucial tasks like that is super important. If we just want to follow on to the next slide. So again, my name's Ashley. You guys are more than welcome to book a consultation with me. My email address is below there. My cell phone number is below there as well. I'll have Clark just put that into the chat as well. So if there is anyone out there that wants a consultation, a one-on-one on how to, switch things up in their practice, how to rely more on automation into their practice, their busy day-to-day, I'm available whenever. Again, my name's Ashley. I was here with Adrian, and I'm just going to open up the chat again to see if anybody has any questions.
Yeah, and this is, I think, the advantage of having a smaller group today, because the smallest group we've done in a webinar is that we have plenty of time for individual attention if anyone wants help with anything or has any topics that you'd like to discuss. So don't be shy.
And maybe, Allison, we can turn on everyone's mic. Enable that, please. So everyone has an opportunity to talk.
And Rosemary, if you're listening, we didn't get to your question earlier. I believe you had your hand up for a bit, so don't be shy to share that now if you can still remember it.
And I think Rosemary, that's Dr. Baird. So Dr. Baird, yeah. So if you want to, if your mic's on, you're more than welcome to ask away.
Well, I was speaking about labeling documents and lab reports as they come into the Oscar. They come in and they come in with, for instance, lab reports come in Chem 1, Chem 2, Hem 1, Hem 2, all the way to Chem 12. And rather than being actually labeled with what they are. And same with the documents, they may or may not come in with proper labeling. And recently we've had problems with them coming in with improper labeling or not coming in with any labeling whatsoever. And it's very time consuming to go through each one and label it.
And are those like labels that go on specimens that you hand out and they have to bring back, drop off to the clinic? Or is it labeling like—
No, these are lab reports that are coming back in to the
Okay.
The title of the documents, right?
Yes.
There's AI that can do that for you. There's, I believe, a solution by Well Health that's designed to automate the incoming faxes and documents and inbox and referrals for you. That kind of thing that will recognize what is on the document, and it will kind of link it to the patient's chart. I know it sounds advanced, and it is. Well Health has this solution. You can contact me. I can link you with them to set this up. It connects with your Oscar, and I believe it interfaces with online booking systems, so you can have your documents labeled correctly faster without the need for you to interfere.
Is that Felix, Adrian?
Yes, I think that's what it's called. That's right, something like that.
Okay, well, that sounds good.
So, and then, Adrian, are you using that?
Well, we don't have that many incoming documents, but I know a clinic that does use this. I believe it's a new system. They set it up, I think, a year ago. and it saves a lot of time because it can be automated, right? The faxes and incoming reports can just be automatically sorted to the patient, which saves a lot of time, like hours per day. It seems significant, right? So
Anyone have any other questions?
I saw something in the chat earlier about labels, right? I don't know if they meant labeling documents or labels for patients, but anyways, I get a lot of questions about labeling kind of specimens, printing labels, because that can be really hard to do a lot of times, especially if you need to do it quickly because you have something on your desk and you just want to get it out of the way. And if you kind of shove it too fast, well, then there's this specimen with no name. If you get mixed up easily, right? That's kind of deadly if something gets mixed up like that. So there's an Oscar EMR. There's a label printing function that's actually pretty easy to use. Everyone knows it. It's from the master record. There's a button for label, but you can also add a label print button directly onto your schedule screen. So if I can't share the screen now, but there would be a button. Oh, there, now I can, okay. So there would be a button right here, kind of next to the appointment for L. If you hover over it, it would say label. Like if you hover over this, it says master record, but there would just be a button called L for label. And the way you do that is that you install, if your system supports the label function just right off the bat. I know well EMR does, and you can go into your preferences and set the option for show label print icon on schedule screen. And then you will have just a button here that will print a label for you. Really easy, right? For the patient. Because most of the time, right, the MOA says, okay, someone comes in, right? They're in the exam room, so they're marked as like the exam room status. And then the doctor says, print the label for them, right? Okay, so you don't need to go and search for them. You just click their label button. But if you don't have well EMR, there's an easy way you can do it as well. I created a label printing e-form for Oscar. You know, most people use e-forms for requisitions and everything, but these are super customizable. So I created one that is a label. Really, that's all it is, right? And this is available if you just go to worldoscar.org. So worldoscar.org and go to the e-forms search and just type in label. I'll put a link to this in the chat, just directly to this. And you can import that to your system just by importing the e-form as usual. And then in preferences, because all Oscar systems allow you to show e-forms on the schedule screen, you can have this show up right here. So you select it. Let's say I would like, I don't know, like LabRec. This is another example of time saving. If you use LabRec a lot, you can have it just show up here and you can click on it. It will launch right away. Oh, it looks like there's an issue with this. this e-form, it's corrupted, but it would show up, right? You would click on it. And if it would be the label printing one, it would print you a label. It's easy. So I'll just stop sharing and I'll put that in the chat.
So anyone else? What's the biggest challenge of your practice that you think technology might be able to help with, that you expect that it should be to help with? Or anything else you want to talk about is fine too.
Okay, so I don't think anyone has any other questions. If Allison, you just want to pull up my contact information one more time. Again, if anybody wants a consultation, they can email me at ashley.rah@cortico.health. Cell phone numbers again, 778-772-8729. You guys can email me and either text me or message me anytime.
Good to see everyone.
Bye-bye.
Thank you, everyone. Bye.